these truths to be self-evident.
That all men are created equal.
As a member of Congress, I get to have a lot of really interesting people in the office. Experts on what they're talking about.
This is the podcast
for insights into the issues.
China, bioterrorism, Medicare for all. In-depth discussions.
Breaking it down into simple terms. We hold
these truths.
We hold these truths.
With Dan Crenshaw.
The Eagle has landed.
What's up, everyone? Welcome back. Another special episode where you've just got me talking to you, except this time I'm answering all of your questions. These are some commonly asked questions about literally everything. This is going to be a fun episode. So it's going to be informative, but also entertaining. I promise you that. All right, let's get started. This is kind of like the mailbag, like Ben Shapiro does, but it's Dan Crenshaw's podcast. And we don't have a bag. We have email and social media. Oftentimes I wonder if he's really telling the truth about an actual mailbag. He's probably not. Okay, let's get started. What does April 30th look like? All right, the implication of that question is this. That's the end of the 30 days to slow the spread. And in places like Houston, that's the end of our own kind of semi-lockdown. Really, what people are asking when they ask something like that is, what is the next phase? What does this look like? How are we getting back to normal? Is there this binary choice between just opening up the economy and letting the disease spread and locking ourselves down in this kind of perpetual isolation? What are we doing? What is the strategy? Great question. And as a country, we need to answer it better. Here's my take on it. And here's the right way to think about this. In the SEAL teams, when we come under fire, we take a tactical retreat. Not always, but a lot of times. And that tactical retreat is meant to, one, stop getting shot at, and two, reload our ammo, call in some air support, figure out what our next move is, maybe plan ahead a little bit. Okay? And then we go on the offensive, and then we win. We rarely, unless things are really bad, do we keep retreating. That would be defeat. And it's usually not an option. This is a similar case. We had to take a tactical retreat because we weren't really sure what we were dealing with. The pandemic hit the world by surprise. This is true despite what the media says. I'll get into that later. And our public health system was at risk of being overwhelmed, the way Italy's was overwhelmed. And we needed to build up our capacity to produce PPE, to produce ventilators, which we've done a pretty great job of. There's our healthcare capacity was strained in places like New York, but it was not broken. And we had to ramp up testing, which we have done and we will continue to do. We had to educate the public on social distancing basics and hygiene basics so that we could slow the spread. But the purpose of slowing the spread and flattening this curve was not to stop the disease. You can't stop it. The purpose was to make sure that our healthcare system was not overwhelmed. And I'm not so sure that part of the equation is being properly told to a lot of people. Because if the only measurement that we're using is the curve itself and the peak of the curve, well, then the implication is that anytime there's another spike, which there, of course, will be down the road, that we should just shut everything down again. And as we've learned, we can't do that. Our economy is suffering intensely. Tens of millions of jobs lost is not an acceptable cost. That has public health consequences, too. Certain medical procedures are not being done. And it's not just nose jobs, people. They're like real medical procedures are not happening in our hospitals. Our hospitals are empty throughout most of the country, unless you're hit really hard, again, in a place like New York City. And so we have to start balancing this out. And what I think phase 2 looks like, I did a podcast on this earlier. It's called Mobilize and Transition with Danielle Allen, where we talk about their Harvard white paper that talks about how to live with the pandemic alongside an open economy. And there's a new normal that will occur. And I think as long as we build our capacity along 3 different lines, one being testing, one being public health capacity or hospital capacity, and third being public education, then we can do this. We can open up our economy with some changes, but but continue living and also mitigate the risk of the pandemic. And then be bold enough to help people understand that spikes will occur, outbreaks will occur, but we will be much better postured to deal with them. It will be really easy, and I've written about this in my recent op-ed in The Hill, it will be really easy to ask the most disingenuous, bad faith questions such as, well, how many lives is it worth to save a job? But here's why that's a bad faith question. For one thing, economic consequences do have public health consequences. More suicides, mental health issues, divorces, domestic violence has gone up. And like I said, putting off medical procedures that need to be done. So those are real consequences for real lives. People's businesses going under and them losing their jobs, that's real consequences for real lives. So that's the first thing. But the second thing is that's not the way we treat risk, right? We live in the real world with real risks. We take risks every day, and then we learn to mitigate those risks with a set of tools. This will be the same, and it has to be the same. We have to balance that out, and we have to have an honest discussion about how to balance that out. So that's what I think post April 30th looks like. That's what I think a staged reopening of society looks like. I don't think we're having a concert on May 1st, but I do think that we can start selectively opening up a lot of businesses. I think that restaurants can seat less people but still be open and survive. I think we can do a lot to get back to our normal lives. And I have a feeling a lot of people agree with that. All right, moving on. Isn't our debt already enormous? How are we supposed to add another $4 trillion in deficits to the already $23 trillion debt? Yeah, great question. It is. This is why it's so important to talk about debt, because there are times when we have to spend the money, and this is one of those times. It's an emergency. It's a crisis. And in order to save the economy after we deliberately paused it, we had to spend a lot of money. And I'd say most of that money is well spent. Obviously, people are mad and upset about some of the spending provisions in that bill, and I totally get it. Nobody wanted the Kennedy Center funded. Nobody wanted NPR funded. They could take outside money already. I get it. I also try to mitigate people's outrage with a bit of context. The goal was to save jobs. Did it save all the jobs? No. Okay. And we fully admit that. Again, I wouldn't have put this in there, but I want to give everybody the facts. The other reason I haven't brought it up as much is because we're talking about millions of dollars in a $2 trillion package. And so I just want to put that into perspective for everybody. I'm not saying you shouldn't still disagree with it. You should, but I want all of us to live with perspective, live with context, and live with all the facts. And I think by nature of doing that, you tend to be a little bit less angry, and being less angry is probably a good thing. Next question. What's your favorite glass eye? Oh, well. The one I normally wear, my sort of go-to prosthetic glass eye, they're not really glass. They're more of like this polycarbonate material. Maybe it's polycarbonate. I don't know. They make a mold of some kind of plastic polymer, and then they bake it. And that mold is based off of the contours of my inner eyeball. A lot of people think that my glass eyes are spheres. They are not. That is from the movies. What they are is kind of like this oddly shaped bowl that sort of slips into your eye socket. And there's a more permanent fixture inside of the eye socket, kind of like a marble. And that's what tissue is wrapped around, like muscle tissue. That's why I can move it, kind of. Not very well. And so it's pretty obvious. Like if I were to wear a natural eye, it's very obvious that it's not natural. And that's why I never wear anything like that. My normal go-to prosthetic eye is the trident eye, meaning like the SEAL trident, the symbol we wear on our chest in the SEAL teams. That's my favorite. That's always been my go-to eye, but that doesn't mean I don't have a lot of others that I really like. I haven't even unveiled them all publicly. It's sort of like a slow process where every once in a while, if it makes sense, I'll unveil some new eye that I got. One of my favorite recent ones is the Gonzalez flag. That's if you're from Texas, you know what that is. But if you're from outside of Texas, you might have seen it. It's the cannon with the "come and take it" phrase underneath it. That's from the Battle of Gonzalez. I have an eye with that flag on it. It's awesome. I happen to like that one. It's also not very comfortable, so I don't wear it a whole lot. That's even though these are supposedly all the same contour and the same shape, they differ slightly, and my eye is rather sensitive to that. It's another reason why it's good to have an eye patch around, because sometimes you just want to take that damn piece of plastic right out of your face. It's not always that comfortable. Related to that question is why I wear an eye patch at all if I have glass eyes. And the answer is kind of like, one is my public life, one is my private life. One is formal, one is informal. That's sort of a way to answer that. Taking pictures and videos and doing all the things that I do as a public figure, a glass eye looks very odd. You can't tell what it is. If it is a cool symbol, you don't know what that symbol is. And it raises a lot of questions. People ask weird questions to your face when they meet you, and they don't know what your situation is. So one time, for example, early on, right after I got wounded, I got my first glass eye with the trident in it and this black background. And this guy in the gym comes up to me. I just started to work out again. And he asked, "Hey, is that a tattoo on your eye?" And I looked at him like he was crazy. And I think understandably so. And I said, "No, of course not. It's not a tattoo. It's a prosthetic." And he was kind of embarrassed, and he walked away. And then he came back a few minutes later with a YouTube video on his phone and showing me, like, "Look, this is why I was asking. I'm not crazy." And it was a video of somebody actually tattooing their eye. Apparently this is a thing. I wouldn't advise it. It turns out it has a lot of bad effects, like people losing their eyes and visions. So don't tattoo your eye, but you'd be amazed. People actually do it and then mistake me for somebody who actually tattoos their eye. I don't know what it is about my demeanor or the way I dress that makes people think I might tattoo my eye, but I do not. When you wear an eye patch, it tells the story right away. It looks better in public. It just makes more sense from an aesthetic point of view. That's why I wear all those. And my favorite eye patch is probably just the black one, I guess. I mean, I have some really cool ones that are specially made that I'm a fan of, but I like the simple black eye patch. It's kind of my thing. All right. Next question. Did President Trump really do nothing during February? So you've seen the media really go and the Democrats really go down this path of trying to place the lives of Americans at Trump's feet. This is just when you think it can't get any worse as far as accusing somebody of awful things, it gets worse. And this is an excessive accusation, and it's a serious accusation. This notion that you might be responsible for the deaths of Americans. I mean, directly responsible. And they're using rhetoric like blood on his hands. This is all Trump's fault, every single bit of it. Our unpreparedness was 100% because of Trump. So like I said before, I like to give you guys context and facts and help you understand what really happened. And the reason they're talking about February in particular was because the first part of the accusation was about, or recently was about the travel restrictions and how those weren't real restrictions. And those didn't really matter, even though everybody says, yes, they mattered. There was a big, bold decision that everybody criticized. Well, not everybody. The Democrats criticized it heavily. Nancy Pelosi, the same day that President Trump restricted travel from China, that same day, January 31st, Nancy Pelosi proposed the No Ban Act, which is a bill that would prevent President Trump from doing that exact same thing that he did. And so we know exactly what a Biden administration or a Pelosi administration would have done were they in charge. They would not have restricted that travel, and our country would be in more dire straits. But the critics claim, but fine, okay, so maybe that was a good decision, but then the president didn't do anything throughout February. Well, again, this isn't really true either. And notice something about that argument. They don't ever say, well, you should have done this. Like, this is what I would have done if I were in your position. See, that would be an honest conversation. That would be some honest critiques, even if it is 20/20 hindsight, because you can always judge with 20/20 hindsight. But they're not even doing that. And I find that to be really disingenuous. And it's important to have some context about what we knew. Like what was the reasoning for making certain decisions back in February? What would you have done to make things better? Would you have really started social distancing regimes? Would you have really locked down the country? Because that's what they're claiming. They're saying, oh, if we had just started earlier, we would have saved lives. But was it really reasonable to suggest that we should have started earlier? I find that really hard to believe. You know, in late February, Nancy Pelosi and Bill de Blasio were encouraging people to go out for the Chinese New Year. Late February. So they obviously didn't feel that way at the time. Why do they feel that way now? They had the same information that all of us did. I don't blame them for saying that. Again, we all have the same information. In previous podcasts, I went over in detail the many headlines that were out from major newspapers and outlets about how this isn't really a big deal. It's not much bigger than the flu. We shouldn't worry as much. Okay. Again, I don't blame them for spreading that kind of information. This was information we all had at the time. The global pandemic hadn't really spread. In places like Italy and Iran and Spain and the rest of Europe, it didn't really spread until early March. Italy did not lock things down until mid-March. Same with Spain. Iran didn't lock anything down until early April. Sweden still has not locked anything down. They're doing a totally different approach. So why does it make sense then in hindsight to say that we should have locked down? It doesn't. Notice that none of the presidential debates, the Democratic primary debates in February, none of them mentioned coronavirus. Again, I don't blame them for that. We were operating off the same set of facts. So what else could have been done? Well, critics will say testing could have been better, right? We could have gotten tests out quicker and faster and better. That's true, but then let's examine why that is. And the reason, as it turns out, it's not that the CDC didn't anticipate it. They did. Two things happened. One, they tried to make their own test, okay? But that test was made more difficult by the fact that China did not give them an actual sample of the virus. So we had to really wait until there was an American a sample of the virus that we could then use to create the test. Then, after a few weeks of working on this, it turned out that the test was really not functioning. It was not good. That's human error. I don't think anybody had any malevolent cause there, and I don't think anybody's decision making was wrong there. It's just, well, it's bad that happened. It's also bad that because of FDA regulations, our private industry couldn't just go ahead and make the tests anyway. But that's not President Trump's regulation. That's not even President Obama's regulation. That's just a long-standing regulation. It's there for some good reason, because we don't want people making things and then selling them that don't actually work. Okay, I get it. But it gets in the way when you're trying to move quickly during a pandemic. That's why the testing wasn't up and running the way we would like it to be. And it's difficult to compare ourselves to a country like South Korea, which did have a testing regime up and ready and running, because the reality is they put that system into place after they experienced similar pandemics, the SARS in particular. So I'm not trying to defend anybody here. I'm just trying to put some context as to why decisions were the way they were and why things happened the way they happened. It's so tempting for everybody to point a finger and to blame somebody else these days. It's like everybody's favorite thing to do. It's a font of our outrage culture. But it's not necessary. You know, there doesn't always have to be one single person that you can lay blame to. Sometimes there's just a bunch of explanations. And it's okay for us to live in that world of nuance, I would think. Okay, but the critics say, fine, the testing situation, it's nuanced, it's complex. Okay, what about PPE? How come President Trump didn't have more PPE just waiting to go? Where are all those N95 masks? Again, I wish we had more PPE. We did ramp up production rather quickly. And many hospitals, especially New York City, were always at risk of running out. Now, they didn't, but they were at risk oftentimes, and sometimes it wasn't distributed correctly once it was delivered. There's a lot of complications here. But ultimately, as a country, yes, we would like to have more than we did. And why is that? Well, if we want to play the blame game, if we really want to play the blame game, and I don't, but we're kind of being forced into it, I might point out that after the H1N1 epidemic, we depleted our N95 mask stockpile by 75% and never got replenished. The Obama administration depleted it, never replenished it. Interesting. Why is that? I don't know. I really don't know. They did spend they spent that money stockpiling other things, namely for things like radiological threats. They don't have a crystal ball. I don't lay this blame right at Obama's feet. I don't think that's necessary. I don't think it's accurate. I want to give people some grace here. I don't think they had a crystal ball. And we fast forward, we also find out that as China was going through their pandemic, they restricted exports. So we weren't getting the exports that we needed with respect to PPE production. And our stockpile of PPE, it clearly changes from hospital to hospital and place to place. I talked to my doctors here in Houston, and they talk about having plenty of PPE, maybe because we're used to bad situations and disasters and hurricanes and the like, and we went through SARS as well. And so it's the responsibility is diffused. It's through a lot of people, in my opinion. We should all be asking ourselves, if we're a hospital administrator or a county, how are we prepared? Are we all just waiting on one entity, namely FEMA, to always save us? Is that a sustainable proposition? Is that a realistic proposition? We're going to have to ask these questions going forward. You know, the federal government is there to support the disaster management that the states and localities actually implement. And we're going to have to remember that sense of federalism going forward. And I hope we do. Here's a good question. What does this pandemic say about single payer, Medicare for all, socialized medicine, and all of that? So I want to start out answering that question this way, because this is what everybody's talking about as far as preparedness for a pandemic goes. And we usually get into a conversation about, listen, how much hospital space do we have? How many ventilators do we have? Those are important questions because these are the ways you save somebody's life. Somebody needs a place to be cared for, and if things get really bad, they need a ventilator. This saves people's lives. So our healthcare system is largely profit driven, which means we produce what we deem to be the right amount of things, whether those are MRIs or doctors, hospital capacity, things like ventilators. Other socialized medicine countries do not, right? They effectively have price controls on their system. So that limits their innovative capacity and research and development, which they can get away with because they rely on the United States to build all the new fancy things and drugs. And then they can just take them. That's a different discussion. But it also means that they are not likely to produce more than they absolutely need. And we see this play out in a place like Italy, which supposedly has this nice socialized medicine healthcare system, but was completely overwhelmed. And so let's look at some numbers. In the UK, I'm going to look at how many ventilators there are per number of people. This is the best way to break down this data, I think, in a coherent way. One ventilator per 12,600 people in the UK. In Canada, one ventilator per 7,400 people. Okay, a little bit better than the UK. In France, they're the worse off, one ventilator per 13,400 people. Germany's the best, one ventilator per 3,320 people. So those are major countries in Europe. But America, one ventilator per 1,941 people. So let's just call that 2,000. So by far, we have the most ventilators per capita. Okay? Which means we're the best prepared to deal with something like that. And I would also note that our system and our ability to industrialize this is so incredible. We're now making up to 5,000 per week. We're not going to need all that, as it turns out. Remember, even in New York City, they quickly took back what they said about needing 30,000 ventilators. Turns out they just won't need that many. What about ICU beds? So on the ICU beds, it's useful to compare ourselves to Canada, our neighbor to the north, and they have the single-payer system that our Democratic colleagues love so much, and we do not. Okay, but what does that mean for actual ICU beds? These beds that are so important when people are in really bad condition fighting a virus. Well, it turns out that in general, on average, they have just under 13 per 100,000 people, and that changes across the country. Some places have less, but it doesn't seem like, looking at the data, that anybody really has much more than that. In the U.S., though, we have just under 35 ICU beds per 100,000 people. We have a lot more space. We have a lot more capacity. We have some of the best experts in the world. We do have the best quality healthcare system in the world. This is the fundamental problem with a single payer system. What it really means is price controls. When you price control something, you get less of it. And that's just the case across the board in any economic reality. And when you get less of it in healthcare, what that means is longer wait times, less ventilators, less ICU beds, less capacity, less innovation. This is the real problem. Less innovation, less incentive to actually create that next technology that's life-saving, that next biomedical device or that next new drug. We are increasingly the only country that really creates new things. And that's I wish that weren't the case. I wish we were competing with lots of other countries, but we're not. Nobody creates the new innovative technologies like we do. All right, next question. Can the president really reopen the entire country or force a reopening of the entire country? And along those same lines, can he really force a national lockdown? I would argue no. I don't believe it's constitutional, and also I don't believe it's practical. Our federalism exists for a reason. Federalism is this function of our republic that allows us to live together peacefully. It allows 330 million to live together and to tolerate each other. Because some people in one city don't want to live under the same rules like people in another city. It's probably why a lot of people are leaving California and coming to places like Texas. So federalism is important. There's different preferences across the country. There's different problems and there's different solutions. The states often act as experimental places to try out new policies. And that's a really cool thing. And in the face of a pandemic, that structure shouldn't really change. I don't see any good reason for it to change, especially since different places experience the pandemic in different ways. When we look at New York as our future, because it's the epicenter right now of cases, you have to question that assumption. Is it really our future? What city is anything like New York? Not even Chicago has the same kind of density that New York City has. It's not logical to assume that we might face the same kind of problems that New York City does, or that our models should mimic what New York City is going through. And then when it comes to solutions, and timelines for reopening the economy, again, that's going to depend on what we're seeing in each locality, in each state. And I think the federal government is doing what it should be doing, which is giving guidelines that it is not trying to do too much to enforce. The other problem I see from a constitutional perspective, and just from a basic rule of law perspective, is the punishments being doled out for violating curfews or violating these restrictions, like you see the paddle boat boarder getting arrested. You see odd restrictions in Michigan where like certain parts of stores are taped off. Like, okay, you can't buy seeds here. Why? You see some curfews, like 9 p.m. curfews in some places in the country. Two problems here. One, these don't appear to have any effect on any actual spread or pandemic. These are foolish policies to begin with, and people will not respect laws that are not respectable. This is an important thing that we ask ourselves as lawmakers. Is this law respectable? On a moral level, on a practical level, should people actually obey this law? If you decided that you wanted to save so many lives by making the speed limit 20 miles an hour, do you really think anybody would respect it? Nobody would. They wouldn't see it as reasonable. You would have an impossible time enforcing that law. You have to think through these things as policymakers. And why does a 9 p.m. curfew, what does that have to do with the pandemic? If bars are already closed, what exactly are you trying to prevent? Does the pandemic spread more at night? Well, what are they trying to accomplish here? And how are people supposed to obey that? And are you going to punish them if they don't obey that? these are serious questions. They're not being answered in a serious way. Next question: What does the next stimulus package look like? Okay, well, as I've said before, I don't like calling it a stimulus package. We're really not trying to stimulate the economy. We're trying to preserve the economy. It's more of a preservation package. We can't stimulate something that we're telling not to work. Anyway, that's just semantics. But the answer to that should be injecting more money into the PPP program, the Paycheck Protection Program, which is the program that basically delivers capital directly to small businesses and actually forgives those loans as long as it's used for payroll and expenses like rent and utilities and things like that. That's a very popular program. It's almost out of money. It's got about $100 billion in it left at the time of this recording. And the objective from Republicans is to inject another $250 billion into it. The problem, as we saw, was that Democrats decided that they also wanted to add huge amounts of money and other funds as well. You know, they wanted to, and I view this as virtue signaling. You can call me biased, but I don't know how else to explain it. Because when you're asking for another $100 billion for hospitals and healthcare system, you have to explain why we need more money. We already spent $100 billion and a fraction of that has been spent. There's still plenty left. There's no point in delivering more just yet. It's more of an opportunity to do what always happens in Washington, which is to say that you're the best politician because you want to spend the most money, which means you care the most. Of course, I think that's a very disingenuous way of looking at things. If you have to convince people that you care about them the most because you want to spend the most of their taxpayer dollars, I question everybody in that interaction. It wasn't just healthcare. They wanted to spend money in a few other places as well. So those negotiations are ongoing, but it should be the next package should be small and strictly tailored to what is actually needed. I do not see a good case right now for another massive package. I just do not see it. Here's one. What's the best way to pass the time in quarantine productively? Well, that's different for everyone. Hey, catch up on some books. This is, of course, after you're done with Tiger King. I mean, geez, that's a staple of the pandemic now, along with symbols of toilet paper. Wow. I mean, you have to laugh a little bit. Get in shape. You know, you don't need a gym to stay in shape. There's a lot of exercises you can do right at home. Stabilization exercises, like yoga, would be an example of that. And you can do planks. You can do planks with one arm. You can do planks moving from one arm to the other. You can do push-ups. You can do inclined push-ups. You can do jumping lunges. I know some of this doesn't make any sense unless I'm actually showing you. You can just jog. I mean, this is an opportunity for, I think, people to get back in shape. And tell you what, from a policy perspective, if we're trying to drive down healthcare costs and reduce our risks to things like COVID-19, then getting in shape is a good way to do that. Read that book, get on Zoom and connect with old friends. You know what I found interesting about this whole pandemic is how much more often all of us are getting on Zoom and recontacting people that we weren't necessarily in contact when we were all allowed to see each other. Right? Like, you're probably, I noticed that a lot of people are reconnecting with old friends, even though it's not as if they were seeing these friends on a daily or weekly or even monthly basis before all this happened. And maybe that's some silver lining, is that we've all discovered Zoom, because I didn't know what it was before this. And I'm now using it to reconnect with friends that I hadn't connected with before. I can't say that my days are not busy. I'm doing things like recording this podcast. I'm doing tons of interviews. I'm writing a lot, trying to get out my ideas on, I think, how we should engage in phase 2, which you heard me talk about earlier for another question. So I don't know how to tell you how to be productive. I just know that you should ask yourself that question every morning, and maybe take this time to build up some good habits that'll make you even better when we get back to normal life. Do you think Biden is going to beat Donald Trump in the 2020 election? Well, listen, I don't have a crystal ball, but I'll just make my own argument here. Over the last month, it's pretty obvious that Joe Biden is going to have a very hard time dealing with stressful situations. I can't imagine an easier place to be in right now as a presidential candidate. All you have to do is go on interviews, make some constructive criticisms, look like a leader, and show people what the other side looks like if you were dealing with this pandemic. But he's unable to string his words together. He's unable to express his thoughts, I think, in a coherent manner. This has changed radically over the last month or two, and that matters. That matters a great deal. I would also point out that, listen, and I've already made the case that I don't think you can look back in time and objectively say that a different administration would have done anything radically different back in February or January or even March. And so to lay blame at the president's feet, I think, is wholly disingenuous. But there is one thing we can say with 100% certainty, which is that a Joe Biden administration would not have restricted travel from China back in January. Many people thought that was too early. It was premature. It was crazy. It was xenophobic, as he called it. So we know he would not have done that. And we know that if they had been in charge, we would have a very different situation on our hands. That's important. And this is objectively true. So I don't know how you don't bring that up throughout the rest of the year if you're going to try and make objective comparisons between who should win and who should lose. Obviously, I do not want to return to Democrat policies or administration. I worry a great deal about that. I have no idea who the vice presidential nominee is going to be. I will be just as surprised as all of you are when that happens, and I'm not even going to try and make any guesses. Okay, this is the question I've gotten a lot in a lot of interviews recently, which was regarding the USS Roosevelt and what I think about that situation with Captain Crozier and Secretary of the Navy, Maudley. So here's what happened. The Roosevelt had an outbreak, a coronavirus outbreak on it. It was spreading. The captain got concerned and wanted to dock in Guam, get his sailors off, get them quarantined appropriately, and do what he thought needed to be done. This, as it turns out, this solution was happening. This had been relayed up the chain of command, and there was preparation in place to mobilize to this reality where they're docked in Guam and getting people off the ship. He also sent out an email to apparently 20 or 30 people outside the chain of command, expressing his discontent with what is happening and talking about, getting his sailors off the ship. That letter got leaked and came out in the media. As a result, he was fired, and people want to know, what's the right way to think about this? Was he right? Was the Navy right? How did this happen? Well, they're both kind of right. I think two things can be true at once. The captain had the best interest of his sailors in his heart. I think he was a good leader. His primary focus was taking care of his people and taking care of his ship. And he was clearly applauded for that as his sailors watched him walk off the bridge. That in that pretty iconic video as that he's walking off the ship. So that's true, but it's also true that there is no good reason for him to send out an email in an unclassified way to a huge email list that is not his chain of command. When it turns out he's already in contact with his chain of command and they have every intention of giving him and his ship what he needs. As a military leader, you just can't do that, nor should you. Our military structure would fall apart if that was the kind of action that we engaged in. Should he have been fired? I don't really take a stance on that. I don't know his history. I don't have his evals in front of me. I'm not on the board that would make that kind of decision, and I'm not the admiral. I'm not his direct superior. But it should be noted for people that commanding officers on ships they get fired more than you might think. It's not this rare occurrence. It does happen and happens for a variety of reasons. The Secretary of the Navy then made the mistake of basically bad-mouthing Captain Crozier on his own ship after this firing, and that was unnecessary. And he held himself accountable and stepped down. So you basically have a situation here where emotional reasoning got the best of two men, and they were both held accountable. And they both made mistakes, and they were both held accountable. And that's, I think, the right way to think about that situation. I didn't really take a stance on it, as you can tell. I just want to give everybody the information and the context. All right, what have you been watching on Netflix, Dan? All right. Well, obviously, I had to watch Tiger King because the entire country told me to watch Tiger King, and so that's why we all watched Tiger King. And now this is the unofficial symbol of the coronavirus pandemic, which is, for better or worse, it is what it is. I will say it is deeply American. How about that? and like the worst and best of. It's like only in America would Tiger King become the symbol of our pandemic, and along with toilet paper. So we did watch it, and it was what it was. It was weird. Everything about that show was weird. We also watched Lock and Key. My wife loves these sort of fantasy shows. We watch The Magicians every once in a while, too. And these things are more and more prevalent on Netflix. This kind of like magic, not really sci-fi, but fantasy shows. And they're kind of fun. So for me, The Outsider on HBO, that was a pretty good one. And a podcast me and my wife recently checked out, The Left-Right Game. It is creepy and entertaining. I would recommend it, The Left-Right Game. I think that's all for today. We got lots more questions, I'm sure, but hey, send them in. You can send them in through our office, the regular way that we always get communicated with. Ask some fun questions, and